My name is Brandon.
And I'm Kaila. How does intermittent fasting affect metabolic health, including insulin sensitivity, lipid profiles, and inflammatory markers? This is a roadmap and a brief overview of what we'll be discussing, including the reasons why people may start intermittent fasting, defining intermittent fasting, discussing our research, including contraindications for intermittent fasting, as well as our conclusion and references.
Why you should care about this research.
Some reasons why people may start intermittent fasting is to improve health or lose weight to be approved for surgery, or they might be trying to fit into the thinness ideal and or muscular ideal, which are two sides of the same coin. Intermittent fasting is defined a few different ways. There's alternate day fasting, which is fasting for 24 hours every other day. There's the 5-2 method, which is fast for 24 hours twice a week, and the time-restricted fasting. An example of this would be eating for a 6-hour feeding period followed by an 18-hour fasting period. However, times may vary for individuals.
Okay, now we're going to go ahead and talk about some of the research that we found.
Effective intermittent fasting diets on glucose and lipid metabolism and insulin resistance in patients with impaired glucose and lipid metabolism. This research pulled data from PubMed and Medline and went through 157 articles, of which 147 were excluded, leaving 10 articles to be included in the meta-analysis. Blood glucose results showed that fasting blood glucose levels had decreased by 0.15 millimoles per liter, and insulin level decreased by 13.25 milliunits per liter. Insulin helps regulate blood sugar in the body. However, there was no significant change in HbA1c, which is the test measuring blood sugar levels over time. For lipid metabolism results, triglyceride levels, which are a type of fat in the blood, had decreased with an average difference of negative 0.09 millimoles per liter, and total cholesterol level decreased by 0.38 millimoles per liter. Cholesterol is a risk factor of heart disease and stroke. There's two different types: low-density lipoprotein, which is known as bad cholesterol, and high-density lipoprotein, known as good cholesterol. LDL levels decreased by 0.22 millimoles per liter, and HDL levels decreased by 0.06 millimoles per liter. Other results of this study showed systolic blood pressure and diastolic blood pressure levels dropped on an average of negative 2.5, and the average weight decreased by 2.51 kilograms. The waist circumference reduced by 2.25 centimeters on average, with a BMI reduction of about negative 0.82 kilograms per meter squared. To discuss that information further, it's important to note that in order to improve and prevent metabolic syndromes from progressing, the goal is usually to reduce body weight and fat, as well as improve insulin resistance. Though the decrease in blood glucose and HbA1c was not significant, the decrease in weight reduction and waist circumference was. Insulin reduction after intermittent fasting results were similar to oral insulin sensitization, but without the side effects that typically come with those medications, implying that intermittent fasting might be a good alternative for some individuals who want to avoid the side effects of oral insulin sensitization. This research supports intermittent fasting as an effective option for patients that have impaired glucose and lipid metabolism, as well as to help achieve weight loss and improve insulin resistance. It's important to note that intermittent fasting diets had therapeutic effects on patients regardless of the specific type of intermittent fasting diet that was implemented. Effective intermittent fasting on circulating inflammatory markers in obesity. The research methods were to search through articles on PubMed, Embase, and Cochrane Library, and utilized 5 human trials of time-restricted fasting and 6 human trials of alternate day fasting. The time-restricted fasting results with a variety of eating windows, such as 4 to 10 hours, had no effect on the levels of CRP, TNF alpha, or IL-6. These are inflammatory markers that affect disorders such as psoriatic arthritis, IBD, Crohn's, and other autoimmune conditions. It's important to note that not enough weight or visceral fat was lost during this study. Evidence suggests that it may require more than 5 or even 10% of weight loss to be able to significantly reduce CRP, TNF alpha, and IL-6. Since this study, participants had only lost body weight reductions between 1 and 5%, that may explain why the inflammatory markers did not have any beneficial changes. For alternate day fasting results, there was no effect on the levels of TNF alpha or IL-6 in overweight obese adults after 8 to 24 hours. However, consistent reductions of CRP in alternate day fasting trials had produced at least 6% weight loss. To discuss this further, preliminary evidence shows that alternate day fasting may be effective for adults with obesity to lower their CRP levels. However, when comparing alternate day fasting with caloric restriction, there are contradictory results. One study showed a decrease by 2-fold in CRP while doing alternate day fasting compared to calorie restriction. However, another study didn't show any difference in CRP reduction between alternate day fasting and calorie restriction. Since the weight loss in both studies was similar, the reasons these findings are conflicting is not certain. Further research is needed.
So the first article I want to look at was done by a group of researchers at a medical school in Thailand, and they looked at the effect of intermittent fasting 16-8, which is 16 hours of fasting and 8 hours of eating, and 14-10, 14 hours of fasting, 10 hours of eating, etc. And they compared it to the control group on weight reductions and metabolic outcomes in obesity with type 2 diabetes patients. And what they did was they took a group of 99 obese participants, i.e. that had a BMI above 30 with type 2 diabetes, and they were placed into 3 groups. First was doing the 14-10 intermittent fasting split. The second group did a 16-8, and they had a control group, which they did not do any intermittent fasting. And they did this for a duration of 3 days a week for the next 3 months. And what each group did consistently was eat a standard diabetic diet, that is, avoiding desserts, eating a diet low in sugar. They kept track of what they eat in a 24-hour food records, as well as office visits with the team's dietitian and doctors. They were looking specifically at the changes in their weight, as well as the changes in their blood chemistry, that is, their fasting blood sugar, A1C levels, and triglycerides. What they found was no significant difference in weight loss between the intermittent fasting groups, that being only found a 4.02% decrease in BMI in the 16-8 group, a 3.15% in the 14-10 group, but significantly much higher in the control group, which was only 0.55%. For fasting blood sugar, there was a significant drop from 30.91 in the 16-8, 28.06 in the 14-10. Again, not really a significant difference between the two groups, but still much higher than the control group at only 9.09 milligrams per deciliter in fasting blood glucose. What they saw in the A1C was about the same, only 0.499% in the 16-8, 0.528 in 14-10, and less than a percent at the control group. And they didn't specify it in the articles, but which I will show in the next slides. They found a decrease in LDL, that's the bad cholesterol, and HDL in the intermittent fasting groups versus the control. We have the baseline of the participants in each group. That is, they all had a BMI above 30. They also looked at their waist circumferences, blood pressure, A1C, cholesterol, and triglyceride levels. A consistent trend throughout all of them was a drop in fasting blood sugar, their A1C levels, and their triglycerides and LDL levels, with the only group being different is the HDL group. But another question that arose from this was this drop due to the fasting or the diet itself? More specifically with the triglyceride levels, because eating less does lead to weight loss. Another thing we wanted to know was that their diet consisted of low in sugar and desserts, which automatically takes off a good chunk of weight off of us. Another thing I wanted to mention was throughout this study that the group experienced adverse effects of heart palpitations, dizziness, and mood changes because they ate a significantly short amount of calories during those 12 weeks. The first 2 weeks, they only ate between 891 calories and 812 calories, and then they only increased to a maximum of 1,300 calories. We looked at a group of scientists who studied the effects of dietary interventions and intermittent fasting, specifically on the HDL function in, of course, obese individuals with type 2 diabetes. And what this study included was a group of 41 participants were randomly selected into two different groups. One of them did a alternate day intermittent fasting, where they ate all their calories on one day and they fasted for the entire day. Maybe at most they ate about 25% of their caloric intake, while the other one did not do a standard diet and diabetes care. Both of these groups were advised and encouraged by a dietitian to follow a diet of eating a variety of vegetables, eating less sugar and salt, and more whole grains and legumes. What they also termed in the study was a Mediterranean diet, and they looked specifically on the levels of HDL in their bloodstream, as well as other components of it, such as a polylipoprotein M, which is a protein, and HDL, peroxidase 1, which is or PON1, which is an enzyme for sugar reuptake back to our cells, cholesterol efflux capacity, which is our amount of cholesterol getting out of our cell and getting removed, as well as the lecithin cholesterol acetyltransferase, or LCAT, which is responsible for taking the cells out of our bloodstream and cells into the liver to be destroyed. The only thing that they really found was an increase in APOM levels in the intermittent fasting groups, but throughout the participants, they saw no significant increase in the HDL components between the fasting group and non-fasting groups, such as it was the same with the cholesterol efflux, LCAT activity, and PON1. Took away from the study was how having a healthy diet and better care of and management of type 2 diabetes was a little bit more important for general health than just weight loss on its own. It did show that weight loss was possible in the groups that did intermittent fasting, but it doesn't really address the other effects of the heart any more than a healthy diet could, which is something that wasn't really discussed a lot in our articles and may be contradictory. While it's still consistent that intermittent fasting can assist with weight loss, more structure is needed to get the whole benefits of health.
Contraindications for intermittent fasting include individuals with a history of eating disorder or history of drug use, pregnancy, and certain types of cancer. In conclusion, what we would like you to take away is that humans vary widely, which can lead to conflicting results. These studies focused on specific blood markers but did not necessarily take into account the overall health of the person, and data that was collected from participants could have a variety of inaccuracies. There needs to be more larger scale research done. Here is a list of our references, and our references continued. Thank you.